Dr. Kosterman with Kosterman Chiropractic in Cary, North Carolina, talking to you about why we get x-rays on your neck when you come in for care into our office. So there are a lot of reasons we get x-rays. One of the most obvious ones is we're a chiropractor, so we work with your spine and the structure. So we want to see what's going on inside. And one thing that we always say is we will never guess about your health. So, there's some offices that are comfortable not utilizing x-ray. We think it's important to see exactly what's going on inside, where the problem is, if it's compressing, where it's compressing, how bad it is, and then that can give us a sense of how long it's been in there, so we can figure out how long it's going to take to correct it or fix it, if that makes sense. Or if it's not fixable, if it's manageable, and to just give you an honest assessment and opinion on what we can do. But you have to look inside to see what's going on, and digital x-rays, which we have in our office, which you can get in 2 seconds, are amazing in what we do. Some medical offices don't use them. You don't necessarily have to see an x-ray of a spine if you're just writing a prescription for some strong ibuprofen or giving you some steroids. But with chiropractic, if we're working on getting in there and finding exactly where the problem is and then adjusting that, sometimes with an instrument, sometimes with a little bit more force, we want to know what's in there. So number one, we don't do any harm, and number two, we can get you out of the pain loop and back to functioning at your best as soon as possible, and then keep you that way. So if you look here, we got an x-ray on a patient's neck, right? And this view is from the side. There's 7 bones in the neck, right? 1, 2, 3, 4, 5, 6, 7. Here's the back of the head. Here's the jaw, right? You see some measurements on here. Number one, there should be a good curve in here, right? See the green line? So this patient's neck should track along that green line. Now, this patient's neck is in really rough shape, right? So there should be a curve, and there should be big spaces between here, between these vertebrae. These blocks are the bones, and in between there should be a space. And in that space, bone, disc, bone, there's a disc. There should be a good space. And if that disc is nice and thick, you can deduce that that bone's healthy, and then that nerve has lots of room and be free. So there's a big nerve window right there. You can see if there's 4 stages of degeneration, this patient would be in stage 4. So there's a lot of compression. No disc, hardly no disc, no disc, no disc. Now just for reference, let me show you what a normal should look like. So seeing this normal, it's got this beautiful curve, right? I always say it looks like a banana, roughly 40 degrees. You see a bone and you see a large space between all of these vertebrae. And then that means that nerve has a lot of room back there. So when you move your neck up and down, side to side, it's not pinching. But someone like this, you can deduce, kind of like seeing a bunch of rotten teeth in their head. They probably hadn't been brushing their teeth for a while. So they've had some trauma in their spine, and segmentally those joints haven't been moving for many years, 10, 20, 30 years, and it's getting worse. Full clarity on this patient, they came in a long time ago, and so this is an updated set of films. They're in worse shape. They have the pain that's screaming down their arm, because when you pinch these nerves, it goes all the way down the arm. And we compare this to their old x-rays, and it's actually gotten worse because they haven't taken care of it. So when you come into our office, we want to get x-rays, and we want to find out what's going on inside so we can tailor the care that we do in our office to you and your needs and be safe about it. So with goal in mind of getting you better, faster, avoid surgery, avoid needles, and avoid unnecessary medication. So give us a call. We'd be happy to help you. Call today.